Police officers and firefighters now often the first to respond to a drug overdose. And when they get that call, the pressure is on them to save a person's life right from the first second. And today, local first responders from all over Tampa Bay came together to talk about their own personal race against the clock and how to fight the opioid crisis that has gripped this state and the country. Our in-depth reporter Anthony Hill takes you there.
I was addicted to opiates, an IV heroin user, for the better part of 17 years.
Cesar Rodriguez has been in long-term recovery for 8.5 years. He's doing his part in the community by simply being open about his story of recovery.
The law enforcement community that I used to be so afraid of, I get to be an asset to today, so the turnaround is truly a blessing.
And he personally knows how important it is for first responders to be able to react when someone is overdosing.
I feel very blessed that the first responders that met me on the scene were skilled and able to administer the Narcan, and that I was able to be saved.
Naloxone hydrochloride, known as Narcan, is used to reverse the effects of an opioid overdose. Cesar said first responders revived him 5 times using the medication, and it saved countless other lives right here in the Bay Area.
Our agency made a decision to move from the 4 milligram naloxone to the 8 milligram.
This is Captain Tony Roach with the Pasco County Sheriff's Office. She tells me deputies have been carrying Narcan on them since 2018. But since the rise of fentanyl, they've had to carry a stronger dose of the life-saving drug. Every day, the 911 line in Tampa Bay receives 34 emergency calls that lead to successful overdose reversals. That means more than 12,000 people a year are given a second chance at life and recovery. Captain Roach says even though they've been making strides and responding better to overdose calls, more can be done to ensure people are put on the path to recovery.
I think that there's opportunities in our community to improve transitional housing, sober living, residential treatment, having people get them out of their environment into some place that's safe where they can learn how to do life over again, substance-free.
On Tuesday, about 250 first responders attended the annual Law Enforcement and First Responders Summit in Tampa, aimed at training and sharing best practices with agencies across the state on responding to overdose calls. The focus of the summit was on our area's fentanyl crisis and what's being done to combat fentanyl overdoses, as more than 5,300 people lost their lives to a drug overdose in 2021. And Florida drug czar Doug Simon told me we're seeing more overdose deaths than years prior.
The increases are due to the traffic of fentanyl to the state of Florida.
A pilot program called Coordinated Opioid Recovery was recently launched to help those who have been hospitalized for drug addiction to give them the support they need after they're discharged.
Once they're stabilized, then there's a team of counselors and peer specialists in the hospital to work with them on their recovery efforts to try to get them into treatment. And if they agree, once they're stabilized, we simply walk across the street to a treatment center.
The program is operating in 12 counties, including Pasco, Manatee, and Pinellas. If you or someone you know is living with addiction, just head over to our website, abcactionnews.com, where I've posted a list of resources that can help. In Tampa, I'm in-depth reporter Anthony Hill, ABC Action News.